scheduled until about 8 minutes after 3. Let's open up the public forum. Questions for anyone? I have a couple. Yeah, right there in the gray. Shannon.
I just had a question maybe about the last presentation, because I wondered if what it exposed was really different senses of what publicness is. And if we think about the Habermasian notion, that was really a notion of public sphere that is linked to issues around deliberation and communication, as opposed to the debates around our public institution and higher education, which is really about social models, about forms of governance and taxation, et cetera, that support public goods, that actually is sort of a different sense. And bringing that back to that notion from Habermas about the need for certain kinds of public spheres to have autonomy from state and economic structures. Sometimes I begin to wonder if we've had a sort of reductive notion about what autonomy from state structures is, so that we actually sort of like get into this position where we actually want autonomy so much that we forget that we might actually undo the values of public institutions that are, based in social models of redistribution and collective care. So.
Did you want to start, or should we? Well, thank you. I should say, first of all, that the opportunity to present here was the opportunity also for me and for us to engage with the text of Habermas, really. And so I can't speak from those who have like a lot more history in economic and political theory and such. We're obviously, I think, trying to juxtapose a very pressing, we think, concern with the type of representation and diversity and the kinds of debates and the people who are even brought to the table, I guess, at the university as a question of publicness. That's a pressing concern, and it's been discussed also with respect to, who's here today in person versus who's here online, and what those kinds of dynamics are. But that's obviously not the same thing as going on, I think, as we use the word public, as it pertains specifically, I think, to the kinds of perceptions of audience and ability to engage in various kinds of interaction in the classroom, both with one's classmates, as one negotiates what happened online and offline in classroom discourse and on blogs, and also with the types of comments and interactions that are available for those who use social media, I guess, in very much broader context. I think I'm maybe talking around this a little bit, but I think it's an effort we're trying to do, maybe bending Habermas's ideas a little bit, maybe too far perhaps, but I hope that it's at least a provocation.
A question for the Argentine press discussion. What I find it, I can speak loud. So what I'm curious is the newspaper that you were working with, the local, the paper version went under, and then they went online. How long has it been online? And then the follow-up kind of background is that I just completed a study of U.S. newspapers who have gone under in the last year and gone online, and a full 50% of them have gone out of business because they don't have the business model. So I'm curious about the success, the path, and then the success of that specific example, and kind of any commentary that you might have.
Let me interject. Is there anyone here from the SF Chronicle, by the way, which is making that same transition right now? Thought it might be interesting. Okay.
All right. So they published the paper for 2 years only because it wasn't such a long project, and they went totally online in summer 2008. So it's been a year and a half. And when it was a print paper, the major, revenues came from advertising. So as well now it is the same. However, since they don't have to publish it, it's much cheaper to sustain it, and the readership actually grew. So I don't know whether that answers your question very well, but the problem was that people wouldn't buy the papers, right? and even when it existed only in the paper form, they already had an online version. So much more people would get information from there. So that's similar to what's happening to a lot of media here. But they've been successful in that. They don't have any. They have slight profits now.
I was sort of interested across the board in terms of the performative nature that everybody was speaking about and sort of the empowerment online, and particularly then how it was interesting where students being forced to be students in a sort of pedantic environment found that uncomfortable, that like everybody else was willing to participate even as anorexics, but to be students online was something that was still abhorrent even to a generation that was intimate with it. With the online communities. My question more, though, is to Marina. You have a beautiful presentation, but it's so matter-of-fact it borders on the ironic at times, and I was a little curious about what you were saying by way of production and value. Are you suggesting in some way that drug companies could be like almost profiting inappropriately from that engagement of the free labor that builds the communities, the niceness? It sounded like you were on the brink of talking about that other half, about the value to drug companies, and I'm wondering if you could expand on that a little bit.
Yeah, definitely. I think to me, my perspective coming to this is definitely, I mean, I don't consider myself a Marxist, actually, quite honestly. I'm very much, Foucauldian, I suppose, or whatever that means, but I come from the cultural studies perspective. And I really am very interested in the type of discourses that gets produced around about medicine or science, and in this particular case, about health. What does it mean to talk about yourself as healthy? And what kind of values it gets produced? And what's really interesting to me, and I will get to the question, but just to talk around it a little bit, is the value of one's life on sites like these is all interconnected with openness. So you have to open yourself up, you have to open your body up, you have to construct of health in terms of being open to these interworkings of the network, in this very much into your body and through your body, in a sense. And this pharmaceutical drug industry, it is really interesting. I am not quite sure if patients like me is at all profitable, and I am far from saying that this is, yes, I run a glib aspect apart. I'm not saying that this is all really bad necessarily. That's kind of a value judgment I would like to avoid, because I think there is something really interesting and perhaps even empowering that's happening there. But what gets lost in that talk of empowerment is specifically that question of at the end, whose health is valuable and for what reason. So I don't necessarily have an answer for you about how pharmaceutical industry profits from it, except that I just started doing this research in Health 2.0. Fundamentally, a lot of it is centered in the Bay Area, being, the new media capital of the world. And there is a lot of very cozy relationship between pharmaceutical industry and Health 2.0. The conferences are sponsored by pharmaceutical industry, and it's not a division that really is questioned by anyone, because the idea is that you donate your body online, you donate your health online, as a result you'll get drugs that work quote unquote better. And that to me is really incredibly problematic. I don't know if that actually answers anything, but yeah, sort of.
We probably have time for one more question, please. Irene?
Well, I was really struck at the echoes between Marina's presentation and Jennifer's. Marina's talking about real people who catalog the ins and outs of their bodies to such an extent that their bodies become primarily information flows, exchange values. And Jennifer's talking about bodies that are literally wasting away, and that the online discourse is shaped to protect these incredibly precarious bodies. And so there's this weird movement between bodies as becoming more and more dematerialized, and bodies as becoming these real things that are subject to decay and death. And I was just wondering if you had comments on, what's going on, like how are people envisioning the status of, the bodies that they occupy as they're writing, and how does that change when it becomes something that's primarily discursive? When it's online, it's just about what people are saying, how they're describing, and what they're not saying as well.
I think that's a really interesting point. That as they're posting and trying to create this body, at the same time, their real bodies are almost disappearing in a way. So that is a really interesting point. And I did notice that there were a lot of connections between Marina's presentation, and it reminded me of an article I read for that medical anthropology course about citizenship and resistance. I think it was a theory by Professor Paul Ravenel and Rosa Novas. And I think that there's a kind of a movement, or a kind of a tendency, at least, towards trying to claim the citizenship, even among the pro-Ana communities. And it's a little bit different because I guess it's marginal, it's a subculture. So I think that it's important to realize it's not quite the same, I guess, in terms of being so broad, but it is a subculture. And so it's about citizenship within that subculture. Yeah.
If I may, it's Nicholas Rose's work about biological citizenship. That's what you're referring to, and it's very pertinent to this, right? Because he conceives of there is this talk of biological citizenship as like these very much noble productions where you are participating in something and donating this data and is engaging with this on the citizenship level. There's this noble, I think they're referring to them as noble ethical pioneers at some point. And I guess in a larger theoretical sense, what's really interesting to me in the point that I was trying to make is exactly in case of identity, right? What does it matter when the body is connected somehow, actually or virtually or whatever, if there is even a distinction anymore, to the nation state as a reflection of it, and what it means to public health and to health of individual bodies, and what it means when bodies are now connected to the network, right, as much more of an effusive entity. And that's something I don't really have an answer to yet. But that, I think, is a really interesting question that we need to talk about, like citizenship in terms of the network.
And it's actually interesting because I originally was going to try to argue, while I was working out my thesis, I was trying to argue that these pro-Ana communities were a resistant, biological citizenship. But I actually faced a lot of resistance from my thesis advisors from arguing that. And I think maybe there is a distinction. There is this distinction, I guess, between so-called more legitimate organizations like Patients Like Me, versus, a bunch of girls who are, trying to form this pro-Ana community. And I mean, I guess it brings up questions of, who is forming these communities, and what kind of status do they have? What kind of power do they have to get their ideas across?
Very good. So I'll just wrap up quickly. I'm glad you mentioned Foucault because that seems to be a reference point that I noticed throughout all of these presentations. And it's easy for us at UC Berkeley to sort of conflate the state with the public, but we might remember that a lot of people position them in opposition to each other. And so where are we at UC Berkeley then? On which side are we? And as a matter of fact, I think in everyone we heard the question raised of who gets to define what is the public sphere. We heard about the state papers, which weren't necessarily serving the public interest, so there were these more populist sort of papers. We heard about the public university versus a larger, more chaotic public that might come in, and the collision between public and public. We heard about public health in the sense that your health equals capital. And then I think we also heard about, perhaps where the only way to take yourself out of that health equals capital and thus control system is to promote your own unhealthiness and to belong to one of these sub-communities that, gives each other anorexia, or similar communities where they spread AIDS amongst each other, which is a very sort of subversive and interesting notion. So I thank you all, and we'll wrap it up.